Nigeria is a country with a high burden of tuberculosis and diabetes. And as we all know in the world, there is an increase in the prevalence of diabetes. And Nigeria is one of the 10 highest countries with tuberculosis all over the world. There has been issues with bidirectional relationship of diabetes and tuberculosis, where people postulate that diabetes increases the risk of tuberculosis, and the other way that tuberculosis also increases the risk of diabetes. In our own study, we tried to see how common glucose tolerance is in pulmonary tuberculosis in Nigeria. And we all know that it has not been well studied, especially in Ilorin on the north central Nigeria. The objective of the study is to determine the spectrum of glucose tolerance in Nigerian patients with tuberculosis. The study was a cross-sectional study involving patients with pulmonary tuberculosis. It was carried out at 10 directly observed treatment short course therapy centers in Ilorin. It was over a period of 6 months. Patients with pulmonary tuberculosis were interviewed, examined, and they were scheduled for oral glucose tolerance tests. WHO criteria were used to define categories of dysglycemia. This is the flowchart of how we select our patients. In all, about 300 patients were approached, and about 71 of them refused to participate, given various reasons. Some of them, it was coming for the second visit of oral glucose tolerance test was not something that they would be willing to do. Of all the patients that were eligible, about 229 of them, 33 of them were excluded because of comorbidities of AIDS, derangement of the liver or kidney and pregnancy. 196 patients were scheduled for oral glucose tolerance tests. Despite repeated call and attempts, about 19 of them did not show for the OGTT. In all, results, about 19 of them did not show for the OGTT. This is the breakdown of the 177 patients who participated in the study. 100 of them were male, and we have 77 female. Majority of the patients were in the age range of 20 to 39 years, and more male had formal education compared to the female, and more males were single compared to the female. Our results of the 177 patients that concluded the study, 42.9% had dysglycemia, and of these, 26% overall had pre-diabetes, which include impaired fasting glucose, impaired glucose tolerance, or the combination of the two of them. Our 30 participants had diabetes, which give us an equivalent of 16.9%. Of these, 11 of them were previously known diabetes, whereas the 19, giving the equivalent of about 63.3%, were not previously known to be diabetes. Conclusion here is looking with the comparing to the prevalence that we have for diabetes in Nigeria. The prevalence here is far, far higher. So our conclusion here is that dysglycemia is common in patients with pulmonary tuberculosis, and the majority of them, as in this case, 63.3%, were previously undiagnosed. And our recommendation is, if it is possible, one, to do longitudinal study to find out whether patients who develop dysglycemia while on treatment for pulmonary tuberculosis, whether they remain so or they convert to normal after the completion of their treatment, and also to look into the outcome of treatment in patients with dysglycemia and pulmonary tuberculosis, whether it leads to more treatment failures or not. So thank you very much. Thank you.